Okay, today the stations that we will discuss, please make sure before I start, I want to put some principles, like any structure, yeah? Like any structure. Whenever we talk about LGBT, what is that term? What is LGBT? Lesbian, gay, bisexual, trans. And now there is Q. Queer. So, yes. So it's LGBT. So please, whenever we are discussing these scenarios, okay? Whenever you have a station about LGBT, okay? Someone who wants, for example, is not happy with his gender, okay? Or someone, she's not happy with her gender. Or someone, for example, who wants to change, or 16 years old, he's getting bullied, or any of these kind of scenarios, please, we'll put some principles now. Number one, you must ask about their mood, and you must ask about their support system. Guys, principles before I start. In these cases, you cannot finish this station without asking about mood, without asking about support system, and without asking about people around them. Are they getting bullied? How do they get on? Okay? That's number one. You can't. The second point, that during this scenario, please, you should not say anything judgmental. You should not even give them any look of judgment. And give us an example about this part of judgment. Doctor, how can I help you, doctor? I'm really worried. I'm not happy because I have some weird sensation toward my friend who's a male. Okay, doctor, that's not really normal. I'm not really happy about it. You can answer in a way that you will lose marks, and you can answer in a way that you're not going to lose marks. A way that you lose marks, which everybody does, well, I do understand how you feel. Yeah, I know what you're saying. That's wrong. No. What you feeling is normal. Why you feel like this? Nothing weird about it. Okay? You understand? You see the difference in answer? So that's one thing which mean don't be. You might be judgmental without knowing. So please make sure when you answer, be careful. Okay? Now, at any case of, again, bisexual, transgender, lesbian, you must take sexual history. Write down. So, sexual history. So you must take sexual history. Okay. 90% of the cases. Now I've spoken about history, yeah? I've spoken about few points in history. So in our history, number one, mood. Number two, support system. Number three, people around you. People around you. Number four, in your answers, be normal. Like, don't say to him, well, I totally understand. Yeah, what are you feeling? Yes, I know why you are stressed. No, it's normal why you're feeling. It's normal. This is what you, this feeling toward your friend, it's normal, nothing wrong with it, about it. So please be like this. And finally, I said you must take sexual history. Come to management. 90% of your management, 90% of your management will be support system. What do I mean by support system? Guys, whenever I mention the word support system, please, I need you to get few arrows because you are confused about support system. Support system. Me, in my house, who's my first support system? Family, which means mother, father, brother, sister, partner. Then, outside my house,
Friends.
the relative. Relative means like any close cousin, any close. And then after that is friends. And then after that is the groups, yeah, support groups. So whenever I talk about support system, doctor, what's your name? Sumaya, Dr. Sumaya, whenever I talk about support system, guys, in these cases, first step is support. Think how I'm thinking, and always when you talk, you say to him or you say to her, you have anybody at home that you're like, guys, please be natural. Don't say, well, and we also have support. No. Say it like this. Do you have anybody at home who you can be talking to? Yes, doctor. No, doctor. Well, any relatives, people around you, and also we can refer to support groups. You see? Okay? Now, support system. What is the second point in management? When I talk about this management, after the support groups and support system, CBT, talking therapy. That's number 2 point. Talking therapy. And 99% of the cases, I mean 99, you're not gonna start with medication. So medication and surgery comes late. So these are the points that you will tackle, please. Rules. Do you think as an FY2 doctor, Dr. Aman, you will be doing surgeries? You will be even interfering in the hormones? No. So support, talking therapy, and later on is the medical and surgical, which you're not gonna go there. In medical and surgical, you will always refer. Okay? So first station, I will give you the stem. This is the notes that you will have. Okay? It will be the stem, and then the positive finding, and then the management, and you know the history, which means you know how to ask about support, you know how to answer the patient, you know how to, the mood, always if the patient is low mood, what to do, suicide, you understand? So the first station is UTI in transgender. Okay? You are an FY2 doctor in the GP clinic. Samantha, 28 years old, came to the GP clinic complaining of dysuria. Talk to the patient, take relevant history, address the concern. Now, this station is medicine or counseling? Medicine. So this station is pure medicine. However, you will have some questions that they will ask in the middle that you need to answer. But the station is medicine. So please think of it as dysuria. Think of it as pain while passing urine. So, the history. Pain, first of all, the problem is passing urine, yeah? So always, because sometimes you get confused. So I have one word here, which is urine. So urine, you need to know color,
clarity,
smell. Is it clear? Is it cloudy? Any blood in it? Okay? Pain while passing urine, and then you'll go to further history, which is associated symptoms like frequency, urgency, and fever. Normal UTI history. Okay. From the beginning of this station, your approach is very important. Why? Because it is UTI in transgender. In which stage are they in the transgender? Guys, I'm here to open your mind. I'm here to not to make you like go with just one thing. No, in which stage? Transgender. In which stage are they? Is she or he under medication? Is he or she still talking therapy? Is he or she having a surgery planned? Is he or she already had the surgery? Are you following me? All of you will have one approach. Usually, she's transgender. She's changed it now. No, transgender could be at any of the stages. Am I making any sense?
Yes.
So that will be very important for you. So, from the beginning, the patient will tell you to call me her, call me him, or so always from the start. How would you like me to call you? Please. How would you like me to call you? Call me Mr., call me Miss. That's it. If a male sitting in front of you and said to you, call me Miss Samantha, would you laugh?
No.
Would you say, that's what people do in the mock?
Confused.
No, that's what happened. One of the doctors did it with me. He looked like this. Seriously, I'm being serious. Yeah, natural. Samantha, he can see a male because it's transgender. Ah, Samantha! And then he started the station. Wallahi, this is what happened. Seriously. Ah, he remembered. Ah, Samantha, how are you? You know? So please, from the start, how may I call you? How would you like me to call you? We don't usually mention this in every station. But no, how would you like me to call you? Whatever they gave you, call me miss, call me, don't be judgmental. And here you will click. Male, giving you Amy, fine. Female, giving you Andrew, fine. Clear? So, very important to watch how would you like me to call you. It's very important because that will make them offended. Okay? So in this case, when you ask how would you like me to call you, you will understand about that. Gender. Are they male, trying to be a female, transgender, or the opposite? Okay? Now, deal with them till the end of the station with the gender and the name that they want you to call them, please. Please. Okay? It will be very offensive if you do the opposite. Do you understand me? Okay? In this case, if it's a male, it's a female, and she's trying to be a male. Do you want to ask her about her period? Guys, yes, you still have your period. Because we don't know yet, so you need to understand at which stage. At which stage of treatment. Are you receiving any medications or have you had a surgery? Please. These questions are important. At which stage? Are you receiving any medications? Are you having a surgery now? At which stage? And then, if there is no surgery, then you can ask about that period. Ask about the period in details. Always ask about sex. Safe sex. Very important. What if I ask the patient, how would you like me to call you? That's one clue. Then I know that it's a male to female or a female to male. Then I start asking at which stage. Okay, yes, she is under medical treatment. No, he had surgery. Then no, under medical treatment. Ask about the period and go as normal history, and that's it. It is a UTI. So the clue and the key in these cases is be careful on what would you like me to call you. Be careful, a male or a female. Be careful at which stage.
So, Direct will ask her if, when she asks her, what do you want, what do you prefer to be called?
What would you like me to call you?
Yes, she will tell you. But after that, how do you open just the topic? She's transgender.
No. What would you like me to call you?
Yeah.
Doctor, you can call me Andrew. And it's a female sitting in front of you.
After that.
Then the patient himself or herself will tell you.
Oh, she will.
Yes, and then be careful because it's a broad term, which means yes, I'm in the stage of transgender. Yes, but at which stage? Medical, am I on medication? Have I had surgery before? You know, please make sure I told you, Doctor, one word. Understand. No, understand which step, where they are in this scale, and then if they still no surgery, nothing, normal. Ask about period and always safe sex. Ask about sexual history and then medical conditions and medications, allergy, UTI station. But I've given you a few things that I hope, when you do the station, you must practice it because it will not come natural until you practice it. Okay? Now, transgender UTI. If someone is a transgender and they have a UTI, are there any risk factors? Are there any risk factors? Okay. What are the risk factors? If a male, because again, we said we are not here to only diagnose, but we are here to find out the
Risk factors.
cause. Yes, you all agree on this, yeah? And we're also trying to find out the
If they're
complication. If a patient is coming with UTI, can it lead to pyelonephritis?
Yeah.
So all we ask about, rigors, are you shivering? And we need to find the cause. What are the risk factors for transgender who's having UTI? What are the risk factors? Okay. The risk factor if he's a male trying to be a female. And what are the, no, nobody asked me. Guys, nobody asked me. When I say what are the factor, you started mentioning factors. Tell me, what do you mean? Do you mean the factor male to female or the factor? Please, guys, I want you to have this. Wallahi, wallahi, wallahi. If you have this attitude in the exam of trying to understand what's happening and be broad, you'll pass. Transgender. What are the risk factors? Are you talking about male to female or female to male? Please be like this. So, a male wants to be a female. Risk factor. They are more prone to infection because they have women's underwear, and you wanna like somehow tuck the penis in the underwear, which create tight. Yeah. So that's actually one of the factors, one of the reason why they can have infection. But would you tell the patient, are you trying? No. That's later if he said to you, why? Can you tell him because you are trying to tuck your penis in the underwear? No. Tell him, do you wear tight underwear? Ah, yes, the wear. It's one of the risk factors. Guys, do you understand me? So what is the risk factor for a female for a male trying to be a female? They want to hide the penis, yeah? So they wear tight underwear. So that's the risk factor. But would you tell him it's because you wear tight? No, doctor, I have not been wearing. No, doctor. Don't tell him. Tell him, do you wear tight underwear? Oh, yes, doctor. Well, it's one of the risk factors. So don't assume that he's doing it. Always ask. Okay, what about the female, transgender female trying to be a male? What are the risk factors? The risk factor that this female, if she is using a medication like testosterone, it's one of the risk factor of UTI because it causes vaginal dryness. So being on medication, testosterone. Clear? And both of them have one risk factor that's shared. They trying to hold the urine in, which one factor here and there. I feel you are lost. Are you okay? Are you following?
Yeah.
Perfect.
It's on both ways.
Okay.
Yeah.
Guys, doctor, are you okay? Yeah. Okay. So, please ask about the risk factor. And how would you know that she's on testosterone? By asking her any medication, by asking at which stage, perfect, at which stage, and that will tell you has she had surgery or what's happening. Okay? So, holding the urine in both cases. Okay? Now, what examination will you do? Because all of you will say, I'll examine your front passage. No, guys. Observation, abdomen. Okay? Now, management.
So you get her protocol for female or male for urine infection.
Okay. Management.
Yeah,
Okay. Management as simple as antibiotics. That's it.
but it's for
What are sorry?
But yeah, for the
No,
you give
no
7
protocol.
days.
No protocol. Male, female, nothing. You're not gonna even mention what antibiotic. Yes, guys, please do not in the exam mention the name of antibiotic. Wallahi, I don't even know in my hospital. The consultant themselves, UTI, yeah, check the system. When you change a hospital to another hospital in the same city, guys, you go on the system, on your computer in the hospital protocol, you find UTI, for example, yeah, lower, upper GIT, lower, you understand? And then you go, and then you go to another hospital. No, we don't use that. Even the blood thinner, we use deltaparin, they use adoxaban, they use enoxaparin. So please, antibiotic according to the protocol. But more important than this, investigation. What investigations you're gonna do? Urine deficit, urine culture, blood. Yeah? Yeah, urine routine blood. Okay?
Urea or creatine.
Yes, when I said routine blood, I meant urea electrolyte, kidney function, infection markers, and urine dipstick, urine culture. You understand? So normal, guys. It is normal UTI. So doctor, why do we call it UTI transgender? Why? Because of the way you talk, because of the way the gender will be handled, because of how would you like me to call you, because of doctor I'm transgender, at which stage, doctor I'm on medication, it could be a testosterone side effect female to male, doctor I had surgery, no period, no doctor she is on medication, ask about the pit. That's why. How would you handle it? But management, simple. Urine culture, urine dipstick, normal bloods, and the treatment is antibiotics. And what's more important than antibiotics? Yes? Plenty of fluids and address the risk factor. The risk factor. Tell her about the risk factor or tell her about the risk factor. Okay? What about the normal UTI? Same. Guys, it's all the same. This station is just about would you be able to talk to a patient who's trying to, you understand? Would you really know at which stage are they in? Would you really understand this topic, or you will just go and, okay, if the patient is a male and said to you, oh, you can call me Samantha, would you laugh about it, or would you like?
So are we gonna ask her?
Okay, Samantha.
Are we gonna ask her about support system here?
Guys, in every single station, the patient can have UTI, normal medicine station, and the patient can come in the same station, or his doctor can have something else, some other query, some other concern. If there is, there is. If there is no, no. You understand me? Because plenty of stations, a patient is coming, is written, pain while passing urine. Okay, pain while passing urine. UTI. Then when you start talking, I'm holding my wee because I'm really embarrassed. Because I'm really embarrassed. Because I don't use the toilet at work. Embarrassed? Why are you embarrassed? Well, because people look at me in a funny way. Which people you mean? And what do you mean by funny way? Has anybody like spoke to you in a bad way, or has anybody tried to show an opinion? So what happened now in the station?
Change something else.
That's what happened in Plab 2. You go, you try and then you go in something else. It happens. By the way, all the time. It happened with me myself in stations, in my exam, and with everyone who is active listening. Somebody who's thinking about the patient, yes. You see in the question. Exam questions, yeah? I'm not discussing anything outside. 25 years old, discharged from the passage. And at the door, gonorrhea. Okay, I will ask about STI, sexual partner. Then you go in. How can I help you? Doctor, I'm really concerned. Why? I'm worried in case of HIV. I'm worried. I feel I'm having HIV. It's going. Yes, you're going to ask about the discharge and everything, but there is something else here which is half the mark. Oh, why are you concerned about HIV? I mean, can you please tell me, like, why? Doctor, because of such and such. Okay, you've mentioning HIV to me, like, sexual history? Sexual history. And then you go into management? Yes, we're going to take a swab. However, you mentioned that I heard about HIV, so start screening, HIV, you understand? And then you will go into the patient maybe having low mood because of stress about this. Okay, safe sex, so you will have a mixed station. You're not going to have a station straightforward from what you have read. But this is all, I know everything, and go, let them do what they want. Okay? Next station. Lesbian, and pap smear. Refusing, or she doesn't want, or she's accepting pap smear. Okay. Forget about this, yeah? Let's have a discussion for 2 minutes, okay? Pap smear. At which age we start? 25. Okay. By the way, this discussion, Dr. Sumaya, this is the discussion that will last in your brain. Okay. Why do we do pap smear? Screening for what? Cervical cancer. Yeah? Okay. What are the questions that you can ask if you are trying to check about cervical cancer as history? Sexual history, multiple sexual partners, family history of cancer, any discharge, bleeding. Am I clear, doctor? Smoking, am I clear? Guys, I forget about the station. Understand? Okay. So now a lesbian is common because she wants to discuss about pap smear. I know why we do it, so I will talk to her about it, why we do it. Okay, and I know the history now because cervical cancer that we trying to screen for. So symptoms of discharge, blood from the front passage, and sorry,
painful intercourse.
and usually you talk about the period as well. Okay, now she's lesbian. Okay, so Dr. Mo, you said that it will be because of sex. What is the virus called? What is the virus? Okay, so but she's lesbian. She doesn't have sex with male. Guys, I'm discussing with the station. She will tell me, doctor, I'm not having sex with males. Why do you do this for me? Why do you check for me? Why do you scream me? Okay, well, sorry?
Transition mode.
No. Was she always lesbian?
No, have you ever had sex with male?
Could it happen that
Have you ever
she was not lesbian and then she became lesbian?
Yes.
One chance? Okay.
Maybe,
Okay, no doctor.
Maybe her partner
No doctor,
had
she
sex with
was not lesbian. She was always lesbian. Okay.
Never.
Her partner, the female,
male. Maybe she had sex with
was she
male.
always lesbian?
No.
Because maybe she was not always lesbian. She has it and she gave it to her. Okay. The sexual toys itself. Because the sexual toy that she use, but if she's using. Okay, if she's having a partner, maybe she doesn't have a partner. You understand me, guys? So please have all this, doctor, in your mind. Okay, the sexual toys itself. Does she share them? If she uses them, yeah. What do you mean by if she uses? Do you share sexual? I don't use sexual toys, doctor. I don't have a partner. I don't have toys. And I'm okay. You understand? So always ask before you say it. Okay. So okay, she's using toys. You know how to ask about the toys and stuff, yeah? How to ask about toys?
Some people they.
How?
Third
Some
party.
people-
Yeah, how? Tell me.
Some
Tell me, a
people
brother.
use-
Brother, tell me, a brother. If you wanna ask about toys, how would you ask?
I would say, you know, some people use sexual toys for pleasure. Have you ever experienced like this?
Okay, some females or some people they use some instrument for sexual excitation. Have you ever experienced the same thing? Yes, doctor, I do. Then you start. Don't assume, yeah? Then do you share toys? You are doing data gathering because that will be your answer to her later. If she's never been lesbian, if she's not always lesbian, is there a risk? Was there a risk?
Yes.
She caught it before. Number two, if her partner, she was not always lesbian,
The same.
the risk because she got it. Because we are looking for the human virus. Sharing toys? Yes.
Another respect.
This is the station. Let's talk about the station.
Yeah.
This is the station. Okay? So, 25 years old, has come with some concerns. You are an FY2 in the clinic, talk to her, address her concerns. So, okay? Do you have any questions?
No.
Okay.
Yeah, fluid exchange when they're rubbing genitals against each other will be.
Yeah, brother, yes. Come on back, Mom. This is the station back, yes. He's saying robbing, there is fluid exchange, yes, definitely. Yeah. Is that what you were... What about the fluid, brother? You forgot about the fluid. Fluid exchange, you know? Yes, it is. Now, so what are the main points that I will take from this station? Number one, please, what is the station about? Lesbian coming because she doesn't want to have pap smear. So, please, may I ask why? That's the start, yeah? May I ask why? Why don't you want to have pap smear? Why you worried about pap smear? Why? You don't want us to do it?
She had one before.
Okay. One more point here. Doctor, I don't want pap smear. If she's 30 years old,
She had one.
has she had one before?
Yeah.
Ask. Could it be the bad experience?
Yes.
Away from anything else now. Could it be that she's not? It's not really that she's lesbian and she, no. Could it be that it was painful?
Yeah.
Could it be? Yes. So always. Why? I'm sorry to come across that way. You are 30, right? Yes. I mean, usually we do it at 25. Have you had your first pap smear? Yes, doctor. How was the experience? Was it painful? I mean, you understand, guys?
Yes.
So always ask about main concern. Why don't you want it? Have you had it before? And what was your experience about it? It is uncomfortable. I mean, maybe for her, okay? So you need to know the reason why she is refusing it. What's your name, doctor?
Tracy.
Tracy. And depending on the cause, the station will go. So, could it be bad experience?
Yes.
That's the station. Could it be because my partner were lesbian? Yes. Could it be that, doctor, I don't have cancer. Why are you asking me about this? So whatever she is concerned about, okay? So why? Ask about the concern, address the cause, address the reason. Did you have it before? Was it painful? Any problem in previous smears? What do you know about smear? Why do you think we use it? We do the pap smear. You assessing her? Maybe she said to you, well, yeah, you do pap smear because you want to check for example, you know, ovarian cyst. Could it be that she doesn't know? Yeah, you tell her. Why do you think we do it? What's her background? We do it because to check for such and such, which is one of the risk factors for cervical cancer. Clear? Then, if she doesn't know, explain to her that pap smear is a test done to screen for the early change of cervical cancer, okay? That is caused by one of the risk factors is a virus called the human papilloma virus, okay? This virus not only is transferred, through sex, but also between a male and female, but also it can be transferred through exchange of the fluids. Not only that, but if she's concerned by, okay, she's lesbian, but she was with a male before, address her concern as your partner who's not always lesbian, so there was a chance that she might have got it and passed it to you. Okay? Now, so in history, guys, do you know now the discussion?
Yeah.
That what we lost in the exam, yeah? This discussion that we had at first, yeah? In history, do you ask about period?
Yes.
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 Sexual history?
Yes.
Which I mean, like, was she always lesbian before that? So period is important. Do you want to ask about, and I said it in the discussion, I said cervical cancer. So, do you ask about any pain, any discharge,
Any
bleeding,
weight loss.
weight loss, smoking, family history? Station is finished. What did you say again? Pain, discharge, bleeding, weight loss, smoking, family history? Yeah, finished. Which are the questions for cancer? That cervical, because the station is cervical smear that we do it for cancer. Do you ask her how is it affecting your life? May I ask you, how is your diet? Do you eat healthy food? Do you drink alcohol? Do you do any form of exercise? So please don't. Clear. Don't. What we've just mentioned, this is your history. Because this station will go slowly, as we talk now. So, this has gone. Psychosocial. I said the smoking. I said I will mention smoking factor. But when I say this has gone, I meant just the smoking you want. Yeah. Clear, guys. After we finish, I will choose one of the doctors to do a station with me from this. I will choose one station and we do it. Yeah. As a simulation. Yeah. And all the questions I've said, everything I've mentioned is here. Yeah. In a bullet point. Have you always been lesbian? Have your partner? Yeah? Always been lesbian, so everything I said is there, okay? In this station, management. What is the management?
What do you think?
No, the management is discussing the concerns. Make sure she's convinced. Now I discussed the concerns and I made sure she's convinced and she's convinced.
Okay, when do you like?
Are you happy
We'll
to
go ahead.
Are you
Are
happy?
you
With
happy to go?
consent.
Yes. Are you happy to go ahead with the pap smear? Yes. Clear?
If she's still
It's fine. Guys,
You can't do anything that she doesn't do.
Then talk to senior. I will talk to my
if
senior.
she's still refusing, I cannot force her. She has mental capacity.
Yeah.
She knows everything.
Yep.
It's fine. She's refusing, she's refusing.
at any
I'll talk to my senior. Maybe
Sorry?
he will convince you.
At any time, give it a thought. Think about it. Guys, think about it.
And I'll get my
And I can even bring my senior if you want to talk to you. But at any time you have any query, yes, he can. Maybe he'll answer in a better way. And you can think about it. And if you want, we'll be more than happy to go ahead with the procedure. Yes. Can she refuse? You have to force her?
No.
Okay. There is a question that I will say, and you think about it. And you are all doctors. Some of you are better doctors than me. So some of you have, like better way of thinking. Okay. In this station, can I ask her when I'm talking to her, and I can even signpost it. Well, I'm sorry to ask you this question, it may sound odd. Have you ever been forced into sex?
Yeah.
Yes.
Does
We
it
can
go
ask.
here?
Yeah.
It
We
does
can
go.
ask.
It does. Why?
Because she might.
Because she might have.
She doesn't want you to put anything in.
She has a phobia.
She doesn't want you to put anything
Yeah.
in. Because that's pap smear. Is something. She's lesbian. Maybe she was straight and she became lesbian. Is it a question that we can ask and be exotic and different from everyone? And a very valid question. Have you ever been forced?
That's
She's been raped before. Maybe that she's coming to you today. No, nobody can come near me. I don't want any of this near. Nothing. Can it happen? So add the question, okay?
If yes, doctor, in this case.
Sorry?
If yes, what we
If yes, psychiatry بقى talking therapy because she's traumatized. You understand? Traumatized? Valid question or not? Very valid.
Don't we ask when?
بقى. It's not gonna be bad.
No, I don't.
And how did it happen? What happened exactly?
هي وين بس على اساس؟
لا لا لا.
اوكي.
لا يعني هو why no? Why no? It's a trauma. She doesn't want to talk about it. She's refusing something, and you want to go into something that is, it's not you now. It's
Another
talking therapy
trauma.
and
Okay.
understand? Okay.
Fine.
You've been in Liverpool for a while now. You look Liverpoolian, huh?
Yeah.
Adidas وحركات وشغل كده, ها? Okay. So let's move. So the station is lesbian refusing the pap smear. That's it. Why you refusing it? What's the background about pap smear? Do you know why we do it? Do you know what? Maybe she doesn't know. You understand? Do you know why we do it? Okay. Any symptoms? Pain, discharge, blood, smoking, bleeding.
Family history.
Doctor, I don't want to do it. Why? I'm lesbian. Since when? Have you always been lesbian or no? What about your partner? Do you have a partner? Yes. Has she always been lesbian? Because you're trying to find the cause. No, she's not. Yeah, she's always been. Oh my God, she's been lesbian all the time. She's been lesbian. I need a cause now. Maybe sharing the fluids is just one of the. It is the fluid. Clear? Lesbian bullying. Next station. I'm sorry today. After this station, after this session, it's all about this, yeah? Lesbian bullying. You are an FY to Dr. GB Clinic. Alice has come to the GB Clinic with some concerns. Talk to her, address her concerns. Okay. In this station, the presenting complaint is panic attack. Is what?
Panic attack.
Panic attack. That's it. This is the start of the station. Let's have the discussion before we start, yeah? The discussion that will fit in your head. Patient, someone who's coming, and her main complaint is nothing but panicking. Panicking when she's going to work. And now, if you have your mind is opened, then you will get to the reason why she is, which is she's getting bullied. But please do not give any clue that you know without this thing is actually indirectly getting told to you. So don't go. How you go? Okay, panic attack. Okay, go. How can I help you, doctor? I panic. Oh, I panic. So how's work? The only body bully you at work? We tell you, guys. We do. Wallahi, seriously, wallahi. From that much reading, we read the scenario again and again and again and again. You say things that is not mentioned and is not being said. It happened with me. You say things that's not being mentioned, and there is a patient, back pain, breast cancer. We go on this station. It's back pain. A patient coming with back pain. She has past history of breast cancer 5 years back, and she's coming with pain. They brought her for me in the exam skinny. Wallahi, I have never seen a woman who's as slim as her. Like this. Malnourished, like 15.5 for example. 3 more. And I'm sitting in front of her. First attempt, yeah? So I will advise you bluntly for this back pain, and number one, I advise you that you lose weight. They started laughing. The examiner and the patient laughing. Seriously, they laughing. Started laughing. She looked at herself. Lose weight? Because it was written that she should lose weight, and she's sitting on the skinny. And you are advising there was something that, yeah, it was in the script. Yeah, and they brought her back and I think lose weight. So be careful, okay? Such things will, they started laughing, or I started laughing, okay? Rest station. Became like a rest station. Seriously. So my point is, be careful. This station, is it written anything about lesbian? In the question, in the stem, panic attack. So how can I help you? Doctor, I have pain, chest pain. The station starts chest pain? Yes. Palpitation, started? Yes, the station started palpitation. Then, Dr. Mo, in 8 minutes, how would we get to the bottom of it? From listening to her. That's it. How can I help you, doctor? I feel heart attack when I go to work. Sorry, heart racing. I feel heart racing just before I go to work. Everybody forget the word?
The word.
Work? Oh, heart racing. And so on, how did it start? Did you lose consciousness? Did you feel dizzy? And they start heart racing. Do you drink coffee? No. Tea? No. Heart racing before work. That's it. You've mentioned to me the word heart racing, and you also mentioned the word work. Can you please tell me about the heart racing? When did it happen? How did it start? And when you have it, do you feel any pain? No. You've mentioned the word work. Always recap so you remember. I always say to my patient, you've mentioned 2 words here. Work and pain. Is it okay if we talk about the pain, then coming back to that? So you will never forget the word work. Then, coming, you mentioned to me that it's before work. Yes, doctor, before I go to work, I feel this. I ask why. Then she will start giving you the story of her getting bullied. She's shocked. She's looking at me. Okay. So if her getting bullied, so don't get carried on. If you listen to the whole phrase, you will be giving what you want in the phrase, yeah? Then it's not medicine station. It's counseling. Then you start talking about why do you feel so when you go to work, before going to work? What do you do for a living? Okay? Yes, doctor, because I'm lesbian. May I ask you, like, at work, now she's saying I'm getting what? Bullied. Can I bully you by beating you up?
Yes.
Can I bully you by calling you bad names?
Yes. By laughing at you.
Can I bully you by laughing at you? Can I many things, so please be broad. You mentioned to me the word bully. Can you please tell me what do they do? And how many of them? You want to know, is it 1?
A couple.
Is it 5? And what do? Clear, guys? Guys, it's just chat. It's just a conversation. Okay? So what do? You've mentioned bully. How do they bully you? How many? Okay.
Have you told anyone?
Do they put any comments? You're asking here. Do they put any comments or any views about lesbian and gay people? Yes, they put comment, doctor. What comment do they put? What kind of views do they have? Okay. How's your mood? How do you feel about all of this? But please, when you say, don't say, so how is your mood? No. Well, that sounded quite challenging. Can you please tell me, how do you deal with that? What do you do when they do that? How do you deal with that? That sounded quite a challenge. That sounded quite stressing. So how do you react? How is your mood? If the mood is low, suicide. And you need to ask her about her.
Support system.
Have you spoken to anybody about it? And coming back to my start, what is the support system?
Family, relatives, friends.
And
Community.
now, as well, have you spoken to the boss about it,
To the boss.
to the manager about it? What does he think?
You want DT.
Have they ever done this in front of the owner, the manager, the boss, okay? What does he do? Have you spoken to him? Yes, I do. What did he do anything about it? Guys, am I clear?
Yeah.
Sorry?
Manager is also involved.
Yes. Okay, now, what is the management? She's getting bullied at work. They're bullying her. So, how do we manage this?
Give her a signal.
دكتورة مها النهاردة, دكتورة مها today, her head is in the sky. She keeps throwing words here and there. She's like very chilled. Yes, sick note. Definitely. I was actually waiting. Will they mention sick note? Now, بسم الله الرحمن الرحيم. She's getting bullied at work. So, stay away from work for now. Am I making any sense? Sick note, indication of sick note. Number one. Then, what is the management? Support. Support before CB. I said we have a support first. People around you, because I can convince Dr. Maha more than the psychiatrist or the psychologist. We are friends. So support number one, which people around her. Have you spoken to the family? Have you tried to speak to your people around you and your close friends? Then start to go about CBT. Yeah, talking therapy.
Should we ask her from first about the self-harm and idea about this?
Suicide.
No, we said already if the mood is, I said it right?
Yes.
If the mood is low, suicide, yeah?
Yes.
But in this case, no suicide. So we're talking more realistic, so support, CBT, talking therapy. Talking therapy. And now, the support, I spoke about friends, I spoke about relatives, I spoke about people around here, I spoke about the groups. There are many groups. And I spoke about CBT, but what's my job here? My tongue. No, my tongue. Yes. You are not by yourself. By the way, don't feel alone. Guys, these guys, they do feel alone. They do feel lonely.
Yeah.
And that was the first ever page I wrote it when I was giving you an introduction here. Okay? Which they feel lonely. Okay? What's that, Dr. Rama? They can feel lonely. So you are not by yourself. You are not
Alone in this.
isolated here. You are not alone. Okay? By the way, if she say no, it's because we are the minority. No, it's not. I mean, at the meantime, it's totally like accepted socially. Please don't feel alone. Please don't feel, understand?
Yeah.
That's the reassurance.
Okay.
But obviously, she must have a sick note. And she must inform her boss,
Yeah.
the owner. And safety rating is,
Suicide.
yeah, but don't go, like, if you want to kill yourself, if you feel low about it. Yeah. You understand? Because you can say safe heading suicide. By the way, some people in this situation they kill themselves. So if you do, come to me. Don't. If you feel low, isolated, okay, you cannot hand. You can call us at any time.
Good Samaritan.
We are here to help and to make sure everything is okay. So please do not say if you want to kill yourself at any time you feel suicidal, don't. Just any time you feel low, okay? So let's go through the station quickly. Simply, the patient is having what? Panic attack. Do not just take her words as panic attack. Carry on.
Explore it.
Carry on. She will say, doctor, I'm having a panic attack. So tell me more. What happened? When do you have this attack? Okay, doctor, I'm having these attacks when? Before I go to work. Where do you work? Why do you have it before you go to work? Check the mood. Suicide. Okay? Remember, if the station starts with chest pain, she might say, no, panic attack. Doctor, I keep having chest pain. Explore the chest pain. And then she will say before the work, then it come work. Monster. So, clear guys? Okay, now.
Any services that can help her at work?
Sorry?
Any services that can help her at work?
Coming now. There are plenty of guys, by the way, there is unions at work here, at any job. Union. Have you joined any union? Union is for people, for employees. They have a union where they can do these things with them. They can talk to them and they can do everything legally by law. Yeah. So, guys, so in this case, I said a slightly different scenario. If the stations are with chest pain, explore it. It's not medicine, but explore it. And while you're exploring it, always in Socrates, there's a question, which is, how did it start? She will give you the word
At work. When I go to
work, yeah? Now, please, at any time she feels so low and so lonely and she's talking about the fact that she's getting bullied and people bully me, you can even use, well, this shouldn't have happened. This is completely unacceptable. It is even illegal to discriminate against anybody based on their sexual preferences. You can, of course.
reinforcement.
So you can use. It is illegal. That shouldn't have happened. That is illegal to discriminate against anyone based on
Sexual.
their sexual preferences. Okay? Okay. And in management, we said bullet points. Bullet point. She's having panic attack before. Stop work. Stop the reason. What is the reason? Work. Sick note. Sick note. Talk to people around you. Support system. CBT. And finally is the support to groups. Support to groups can include the LGBT groups. Yeah. And support to groups is joining a union. Okay. And support to groups start from you yourself. By you are not alone, you are not lonely, the assurance, then people around her, family, friends, and then the boss at work. Okay? But don't say to her the boss at work before asking in history that.
If he's part of them.
Because imagine if you say to her the boss at work, oh my god, Daras al Hayya. He's the one who always support them and no. So always history. Have you spoken to the boss about it? So support is in the history and in management. Okay? Next station. Sorry?
So if the boss is involved, does she go to the Citizen Advice Bureau or what?
No. You're not here to as an effort to direct to offices or something. Guys, Citizen Advice Bureau from the name. Citizen Advice Bureau. Bureau is a office in French, yeah? Yeah. So it is here. Offices that you go to, they advise you about your rights and you know. So it's not, if the boss, I will send her to, she can even go if it's not the boss. It is an office for everyone, okay? That you can say it in any station, Citizen Advice Bureau. It's an advice you can get for housing benefit. If you're not working, if you are homeless, yeah, you go there and they tell you what are your rights and options. So regardless manager or not, you can, okay, refer her to the Citizen Advice Bureau. Next station, which I like this station, it's nice. Teenage sexual preferences. Teenage 15 years old coming to the GB clinic with some concerns, yeah? How will the session start? Confidentiality. He is not opening. He is shy. He is worried. This is the start. This is the approach. This is the most important part. How to make her open, or him open.
We're
How?
here to help you.
Please, guys, if any patient is low in mood, if the patient, doctora, is upset, is not happy, your tone of voice.
You change your tone first.
Andrew, we are here to help you. Please open for me. Look at my voice, please. How can I, doctor, I'm Dr. Fatah, can you please confirm for name and doctor? Can you please tell me how can I help you? He's low. Well, I'm here to help you. I'm here, no, your tone of voice. Are you right? I can see.
Far away.
It's fine. No, it's gonna be like this. Me and you like this.
No, it's a new building.
No, same. Don't worry. People when they say new building, go like this, yeah. Andrew, I'm here to help you. Please open for me, and give it 2 seconds, yeah. Andrew, I can see you are not alright. Andrew, please open for me. I will try my best to make sure you are okay. Look at my voice, yeah. 2 seconds. Don't. Andrew, I can see you are not okay. Can you please open for me? Andrew, please open. Andrew, I'm here, you know. Me and seriously. And Andrew, everything is confidential between me and the nurses and the family and the...
No way.
So, please guys, wallahi, they know that you are trying to approach. If you approach well from the start,
That's it.
Everything will be open.
don't panic,
No, it's taking time.
don't speed. If he's not opening, to start. No, he will open that way. For some people, you don't even see. They say the 4 steps in one phrase. Wallah, one phrase. I'm here to help you. I'm more than happy to help. Please open for me. Please, you are here not by yourself. You are all here. Anybody comes to this door, don't worry, they have problem. Confidential. All at one phrase. Don't. Okay. So please. So at the beginning, he's gonna be shy. He's not opening. Try to open the conversation by
The step.
the assurance, the steps. Tell him confidentiality, but don't say to him confidentiality between me and you, between
You and medical
me and
team.
you and the medical team, or between me and you and any of the medical team that we think we may in the future want to involve. That's it, yeah? In this station, please, no DSA. No, apart from this condition, any other medical condition, he doesn't have medical condition. He does not have him coming to you. He is saying, I'm worried because I'm attracted to a male. Apart from this condition, do you have any other medical conditions? Seriously, it's not a medical, there is no medical conditions here. You understand? By the way, that's very common in the book, yeah? Apart from this condition, any other medical conditions? So no.
Other concerns.
Concerns, not medical conditions. Concerns, okay? Don't ask him about DSA. The guy is not happy with his gender or how's diet do what's happening now. Seriously, don't ask him to do any form of exercise. Do you drink alcohol? alcohol here can be a stressor.
Yes.
بص على quick jump انا قلت alcohol can
But first,
alcohol here in this station is a stressor. People when they get stressed, they drink. Okay, so diet, smoking, yes. Smoking, is okay. But please, irrelevant the question. Diet,
Appetite.
exercise,
Appetite is
relevant. Appetite, not diet.
Exactly.
Yeah,
Emotional
appetite.
eaters.
Now, if someone is depressed, we always say, I've said it even who attended, I've said it in one of the videos recently, one of these videos. I said if someone is depressed, it affects their appetite, their daily activity, and now we know they are depressed. If they can't be bothered doing things, if they cannot eat, of course, yeah. So appetite is important, yeah.
What about if he's
So,
diabetic?
sorry?
If he's diabetic from the beginning, he can't like. I think maybe he's diabetic.
Yeah, but they're not gonna look in Plab 2. They will not bring a station like diabetic, not hypo the gender. Clear? They don't. They're not gonna bring a station, medical condition and counseling, and like a station psychiatry, like no, okay. So now, how would you approach, doctor? He will tell you, yeah, I have weird feelings toward my friend. Toward my
what do
friend.
you mean by this?
So, what do you mean by weird sensation? Or weird feelings toward your friend? What type of feelings do you have? Because maybe hatred, maybe love, maybe jealousy. Don't always think it's the station of the 15 years old who's having sex with the wants to have. No. Please explore that. Feelings. What type of feeling? Why do you think it is weird? Why? It is normal. Why do you think it is weird? There is nothing wrong about what you are feeling. Okay? There is nothing wrong about what you are feeling. Okay? So, we are recording now. So there is nothing wrong about what you are feeling. You understand? So, why do you think it's wrong? Okay. He said, I am having weird feeling toward my friend. I asked him about the weird feeling right now. Why? What do you mean? What feeling? But we forgot that. So I will say it like this. Andrew, you've mentioned the word weird and friend. Please, coming back to the word weird. What do you mean by weird? What do you mean? What kind of feelings do you have toward him? Why do you think it's weird? Coming back to your
Friend.
have you spoken to him about it? What did he say? I mean, how do you know him? School or مصنع الكراسي? Where? How do you know him? So please explore about the friend. You need to know about the friend. Okay? Maybe he's 15 and the friend is 19. Yeah, yes or no? Yeah, more friends. And at this time, someone over 18 and someone under 16. Are you following me?
Yeah.
So ask about the friend. How did you meet him? Okay? And how old is? How do you know him? School or he's your elder brother friend? What? How do you know him? Yeah. Because he is 15. Yeah. Because one thing I've noticed as well. Doctora, what's your name, Doctora? What's your name? Dr. Nairuz. What's the name of Nairuz?
It's in Paris.
Paris.
Name Paris.
Yeah. Dr. Nairuz, where are you from?
Libya.
Libya. Dr. Nairuz. أنا نسيت كنت هقول. What is the last thing I said?
15-year-old.
Yes. In Plab, people are used to this. If you look at the question and they see emergency contraception, this is the 14 years old girl, ask about the partner. That's it. Only partner if she's coming for emergency. But this case is 15. So ask about the partner age and the partner. So please, don't think of Plab as a script. Emergency contraception 14, ask about the partner. That's it. Any other station, no. Only this station. So here, you must ask the partner. How did you know him? How did you meet? What is the age? Okay? Now, ask about the partner. Did you tell him? If he said yes,
And what did he say?
what was his reaction? Okay? Okay. So don't forget your presenting complaint is feelings. That's it. What is P1?
Feelings.
Feelings. Do you know what I mean by P1 is feelings?
Yeah.
P1, how can I help you? With the feeling. So when, how,
What do you mean by
and what do you mean by weird? What type of feelings? Okay? Okay. In this station, sexual history, important or not? Yeah.
Yes.
Sexual history. You wanna know, are you sexually active? Because maybe he's having weird feeling toward his friend who's a male, but he's in fact now sexually active with a female. Can it happen?
Yes.
Fine. It's fine. So ask about sexual, are you sexually active? Yes or no? And if yes,
Details.
detail, because you want to know the problem here is feelings, and he is attracted to a male, but he could be sexually active with a female, for example. Okay? Mood.
Yes.
If the mood is low, suicide. Drug and alcohol. Why drug and alcohol?
Because stress.
Stressors. Anybody goes through what? Stress. They can go to use,
Alcohol.
to drink alcohol and take drugs. Yes or no? Now, guys, I've taught few sentences at the start of the lecture. Now, do you want to ask about people around him?
Yes.
Have you spoken to anybody about it? Siblings, parents, friends. What do you say?
Smart.
قولي يا أيمن يا
She
سماعة.
had a mock today. She's tired.
She's tired. Guys, if you want to go, yeah. Ask about the relative, people around him, friends, support system. And in this station, he is worried about his family. Worried about?
Family.
He's got a sister, 20 years old, and his mom and his dad. Not happy about this. Is it important?
Yes.
What do you mean by not happy? How did you know that they are not?
happy. They're not accepting it.
Have they put any comments in front of you? What's their views about,
This.
okay, this issue? What's their views? Have you spoken to them? What do you think the worst can happen if you tell them? What is the importance of this question? What do you think is the worst? Sorry? His safety. What do you think is the worst can happen if you tell them? Well, my dad is from Egypt, and my mom is from Libya. Mix. And Egypt and Libya, you're not gonna go anywhere. Understand? So, and if this happen, okay, they're gonna kill me. Doctor didn't even know. It's against our religion. It's against our, you know. Now, you might not even send him home. Safeguard them. 15 years old, and this is going on. And then the station can finish in like 5 minutes, and that's it. You don't even continue. This is the safety point in the station. Are you following me? Just one phrase can change the whole thing. Okay?
So how do we safeguard it? Should we involve social services?
Yeah, that's social services, yeah. Yeah, if he mentioned this, guys, they are the same thing, yeah. Social services, safeguarding, the same. Okay. So if he mentions this, what I said, yes. Okay. Don't say to him, no, don't worry, because some people, it's funny, but I have to tell you, some people they understand rapport wrong. Rapport wrong. No, don't worry. At the end of the day, they are your mom and your dad. They're not gonna hurt you. That's in Egypt. Seriously. That's what we say in Egypt. Nah. You're your mom and dad. Come on, you're not gonna do that. It's mom and dad. You know? Okay. Because there was a station about. Whenever I give you example, it's something happened. There was a station about the lady who wants to have a baby boy. Yeah. You've heard about it. She wants a boy. She's got 3 girls and she wants a boy. Gender selection. And tell me how to, I want to have a boy, I want to have a baby boy, And no, I want a boy. Why? Because my husband have 3 girls, and my husband want a boy. Dr. Sharihan from Saudi Arabia. She's family medicine. She said, no. If he tells you this, that means that there is another woman involved. Wallahi. She thought she's building rapport by telling me he's got another woman. That's why he's making an excuse to leave you. He's saying to you, if you don't give me a boy, I will leave you. No, he's got another woman. That was her rapport of making me, assuring me. She wants to tell me, you don't need this, okay? There is some issue there. So please, that's wrong rapport. Another rapport in problem colleague. In one of the stations, I was coming late because my parents are having troubles at home and they are going through divorce, and they shout in the night and I cannot sleep. She told me, come and sleep in my flat. Seriously, the female doctor, she said, and I even did it in one of the Facebook group. I was like, you know, come and sleep in my flat. You can come and sleep with me. That's not acceptable. I mean, you understand? I'm pretty sure to replace our. Then the station started, you know, going, and by 8 minutes, she said, okay, so now I highly advise you that you take some time off work and now go home. But I said, no, go home, come to you. You told me 4 minutes ago that come and sleep with me in the flat. So my point is, please don't overuse rapport. Don't overdo it. Yeah? No, rapport has an end. Don't say come and sleep in my place if you are not comfortable at your place. And then when I spoke to her, she said, I'm from Pakistan. I'm in Pakistan. I will have my colleague with me. I said, so in Egypt we do the same, but that's too much. When they say come and sleep to your colleague, and then you tell him come and sleep with me, come and sleep at my flat. You understand? So no, that doesn't happen. So rapport, 2 limits. Okay? And the same way, if the patient say, how can I help you? Doctor, I have some headache. Headache. When we have a patient with headache or pain, say, I'm really sorry about it. I am totally sorry. Please, are you comfortable now? No, guys. Even when the patient is in pain, do not. Don't overreact. Are you comfortable talking to me? Are you in pain now? Can we have a chat? Yes. You understand? Don't say sorry, I'm really sorry. So even when you show sympathy and empathy, moderate. Don't exaggerate it. Clear?
Yeah.
So this is station. We said don't forget alcohol, drugs, mood, family. He will tell you that my family are not happy. Ask about why. What do they show you? What do they tell you? Have they ever given any views? And explore. Management. Okay. After history, do you want to examine him? No. Examine what? Examine only بقى. You tell me. He's not happy and he's having weird sensation toward his friend. What do you want to examine? Huh? Don't examine anything. No, seriously, yeah? Don't examine, because some people do say, I'll examine your front passage or examine your... Why? Don't. Okay, so no examinations. It's... What is the problem?
In his mind.
In his mind. So, no examination. And what is the management? What would you say in management? Guys, write one word. One word. Reassurance. Write that word. Reassurance. Number 2 word, support. And the support will start from you as well. You, if the family are not abusing, so the family, the relative, but if they are, what to do? Safeguard. Okay? Groups, support to groups. That's if this 15 years old is thinking it is weird, because there might be another scenario coming later, different. So this scenario, what is how is the scenario? Doctor, I feel it is weird. That's it. Weird sensation, weird feeling. Doctor, I feel it's not really appropriate. No, nothing wrong with how you feel. Support system, reassure, family, friends, exclude bullying. Have you spoken to anybody in school about it or college? Anybody bully you? Anybody put? Why you are worried? Why is he worried? Even in school, that's it. There's another station coming later. It's something else that you will refer him to. Yeah,
What about family therapy if they are not supportive?
you can family therapy. It's fine. It's fine. Family therapy. If they are not supporting him, yes. What was family counseling? Fine, guys. Everything is fine. But what I said, this is fair enough for your time. 8 minutes. You have time. You can see anything. You can see. You can have a meeting with the parent if you want. If you want. Okay. Okay. Next station is gender dysphoria. Okay. Okay, guys. Dr. Nairuz, what was the first station? The one that I've just finished. What was the station? Did he tell you? I'm just trying to differentiate so you know, yeah? Because it's a different, I'm gonna say a different station now. The first station, he was worried, yeah? His feelings, these feelings was worrying me. What's, you know? I called it sexual preference. But look at this station coming, something else. But you guys deal with all of them the same. This is no. This is, he is feeling that his body is a male.
He's not comfortable.
Yeah, but he's not comfortable. He feels that he should have been a female, and he feels that he's trapped in a female body. What is the difference between this and the other one?
The other one talks about
Guys, the other one is like feelings, and doctor, I'm worried about it, and this and that. This one, he's not happy. It's called gender what? Dysphoria. The other one was sex preference. The other one was sex preference. The feeling toward male or female. Do you see the other one? How I was talking about it? My feeling toward the male. No, my feeling is toward, doctor, I'm a male, and I've got feeling toward a
another
male, not a female. So this is sex preference. It's the preference. I hope you understand. This is because many people get confused, and I keep talking, and then we get at the end. This is dysphoria. He is not happy with his gender. He thinks that his body is trapped in a male body, but he should have been a female. Or she thinks her body is trapped in a female body, but she should be a male. Okay.
It's like a transgender. You want to be
Yes, this is the beginning of transgender.
like feeling towards himself.
Now she will start thinking about it.
Yeah.
Not here. I'm talking
Yep.
in the station because understand. So now it is the start of transgender. Now you give the best description.
Exactly.
Dr. Patricia, Upper Egypt. She gave the best description. خلاص بقى في الفيديو بقى باتريشا Upper Egypt خلاص for about 2 years. You understand? She said to you, it is the start of transgender. This guy who is not happy because his body is trapped in a male, he wants to be a female, then he's gonna be the one who will go through the process of transgender. But the other one, no. The other one is preference. He is a male and is attracted to a male. Doctor, when I see the other one, doctor, I have a feeling, doctor, that really strange. It's confusing, doctor. You know, making me. When I see my friend, I'm a male, doctor. Yes. When I see my friend who's a male, when I wait till he turns back to look at him, and I feel feelings toward him, and I have that, you know, that's something preference. But the other station I will do now, because I always have confusion, and you always miss it in the mock. In the mock, you put this one, you talk about this one. No. Something else. Hi, boy. I'm not happy. Yeah, I'm not happy. I'm not happy. I feel my body strapped. That's dysphoria. From the autism of dysphoria.
Seeing himself in another form.
Dysphoria, think of it as disfigurement. It's not disfigurement, yeah, because haram, say disfigurement. But he's thinking that his body, shouldn't be just inside me there is a female, but it's a male body. Like in Egypt, Sphinx,
Yeah.
lion كده ماشي. Laugh, brother. So, gender dysphoria, first of all, it is different. I even wrote it to you in the first line. It is different from gender or sex preference. The first line. The second line, in gender dysphoria, in this case, he is confused about his gender. He is thinking that
He should be in
He's trapped in a
the body of the man, he's a female but trapped in a male body.
Yeah.
And they used to bring it
Yes.
a male. But now it is
female.
female. Oh, they can. Is it only a male trapped in female? No, it can be female trapped in male, whatever. So deal with them all the same. But don't be shocked. If you have a female, guys, are you bringing the wrong question? It was a male. It's fine. Same thing. Okay? Okay. Please, in these kind of stations, we have a fixed point that we spoke about. Fixed point, which are in every station. What? Support, mood, and sexual history. Yeah, maybe, yes. Why is it important? This doctor is no sexual, because he's thinking that his body is trapped, but he's thinking that he should have been a female. You want to know his sexual preference as well? Is he attracted to males, attracted to females? And so don't forget the main point that we mentioned in the first page: support system. You've spoken to anyone about it? Mood, yeah, and sexual history. Okay. Now, in these cases, alcohol is important. In these cases, drug is important. Drug is important. Sexual history is important. Clear? Okay. Sorry?
Online.
Medication online and medication.
F. What do you mean mobile prescription?
Online, you can take an oestrogen and start.
Guys, we're not gonna advise
No, you're not.
anything.
Maybe he comes to you.
Yeah.
Maybe
Maybe
if he comes to you, you don't advise any online medication.
Medication history.
He bought online.
Yes, you advise him not to.
Of course.
But we
Yeah.
ask
You should
him.
ask.
Of course, guys, we
Yeah,
know that.
but-
What do you take? Sorry, I just, like, there are principles. If someone is taking things online, online medication, how to approach it? Anybody in any station.
Are you taking any medication?
Okay, he will say, yes, I'm taking online medication.
From where you?
Online.
Who prescribed?
Yes, who prescribed it, medically approved through a
You know
doctor.
it's not medically approved.
You understand? Yeah, through a doctor, no doctor, it's online. I take it online, then advise him about
Not taking it.
not
Stop
taking it. Okay? In management,
Refer to the clinic.
what do you think you refer to? By the way, again, before referral, Dr. Maha, before referral, what are the rigid points in this management?
You are in.
Support, not alone. والله شباب يعني والله. This is the 90% of management. Because any other management, you're not gonna do it. Your management is this person will be leaving, supported, not by yourself. You are not here alone. Yes, you understand? And if he said to you, you are not the minority, you understand? Always assure that.
Yeah.
Okay? What else in management? The referral that everybody get confused about.
Gender identity.
Referral. Who to refer to? And by the way,
How old?
when you refer, who to refer to?
Sexual health clinic.
It depends how old. What do you mean?
If young,
Okay?
gender identity
So-
development center.
Gender identity or gender dysphoria clinic. Above 18. Why above 18?
Because
Because treatment will not have a court
He's a man.
promotion.
Yes, because he's an adult.
yeah, puberty has passed. And
What if 16, 15, 14?
development.
Gender
development.
development clinic or developmental identity clinic.
Okay.
So basically the age, the cutoff is 18.
18.
If he's over 18, he's an adult.
Gender identity.
Gender dysphoria clinic. If he's less, if he's young,
Gender
Identity development.
gender development identity clinic.
Okay.
Okay? Now, don't forget the other points of management. The support, the family, the mood, the reassurance, that's your job.
Okay.
And later on the referral is somebody else's job. You're not gonna do anything about it. Okay? Now, because it is gender dysphoria, because he is a male that thinks that his body is trapped in a
Woman.
female, always be careful. You remember the first Dr. Patricia. What did she say, Dr. Patricia? She said,
Beginning
this is the
transgender.
beginning of transgender. What did we do in the transgender UTI first station?
How can I call you?
How can I call you? Very important. So it's the same, because he's thinking the body's trapped.
Yeah.
So very important. How may I address you? Because it's a start of transgender. He is not happy with his gender. So always focus on how may I call you? What would you like me to call you? Okay? And that's it. Nothing
The
else.
STEM will give us his name as
Yeah, the STEM will give you his name, but when you go in, you'll find different gender.
he's saying
That's
something else.
such cases, yeah? Okay? And this is what happened.
That's
What we change the name in
Samantha, and there was a male. It was a male inside the cabinet. Samantha. No, doctor. When he went in,
Don't call her this name.
he's looking like this, looking at the question.
I'm sorry.
Ah, Samantha. You know, so don't do this. I mean, Samantha, don't worry, you're not gonna put the wrong question. You understand? Samantha. If you open the cubicle, a female, and it's written in the question, for example, Andrew. Don't show them. Oh, Andrew. Tamam. Oh, this is the station one. We said we have to have such a station. This is the Andrew one. Please, no, don't laugh, don't smile. Just, okay? These people will be having stress.
Suicidal
thoughts,
thought.
Please, if you miss
support
stress
suicide.
in these kind of cases, if you miss mood, wallahi, you're not gonna pass. They will be going through so much stress, through what they're feeling. You need to reassure, sympathy, empathy.
Okay.
And when I say reassure, you can't reassure me physically, your face, your body. Reassure, okay? Safety netting.
No more
Okay.
suicide.
What if they're asking about medications? Can you give the medications?
No.
No.
The patient
Yes.
If the patient
If the patient is already using, then we can
Okay.
prescription bridging, I think.
yes.
If the already using,
Hmm.
then we will contact the gender identity clinic.
If they have not started the medication, can you start them?
No.
If they plan to do it,
If he plans to do,
the risk of suicide,
no, if he plans to.
I can ask for the call. I can call direct
Guys,
the clinic to have a sick medical
In
advice
this,
and
you're not gonna be prescribe medication yourself.
Okay.
Okay? In this, the specialist will prescribe. So when you refer him to the clinic, tell him where they will start with you. Okay? The process of medications and anything you will be interested at. You don't give medication.
Okay.
Doctor, what's your name?
Amani.
Dr. Amani, talking about, yes, if he's going through tough time, he's gonna kill himself, I can ring for him that clinic and ask them what to start him on.
Lowest possible
But that's not a
dose.
Plab scenario.
Okay.
Don't say, it is a real life scenario, but not
I have to.
Plab scenario. No, Plab scenario is,
Do not.
no, it's, I will refer you, they'll give you the medication. If he's on medication,
Cannot stop.
what if he tells you, are you on medication? Yeah, I started estrogen.
Counsel
Tell
about
him.
it.
Tell him about
then
the
I
risk
think
about it.
No, I mean,
and ask for
Dr.
low
Amani,
dose.
ask me in the station, are you on medication?
You are in estrogen?
No, you ask me now, are you taking any medication?
Are you taking any medication?
Yeah, I'm using estrogen, doctor.
Okay. Could ask you who prescribed it
Ah,
for you.
don't think it is always gonna be online. How did you get it? Who prescribed it for you? Because it could be a doctor. Clear.
Yeah.
Don't make assumption But in the station, he will tell you, yes, I'm buying estrogen online. If I'm saying to Dr. Ma, yes, I'm using online estrogen, I'm buying estrogen from online websites, how would you advise me? Yeah, tell me.
I would advise you to stop it.
Yeah?
Okay.
No, I don't want to stop it, doctor. It's good. It's good. It will help me.
Okay. We don't know the source of the drug, and we don't know.
It is
the
estrogen.
component.
It is estrogen, doctor.
We don't know.
FDA approved.
It is estrogen, doctor. I know it's estrogen. It's written estrogen, and it is estrogen.
Do you know how much percentage of the estrogen?
Yeah. It's safe. I think it's safe. Yes.
Okay, we can call the specialist, so you get the drug from a safe place.
Now you could have used your
Risk and risk.
way of risk. Risk. Guys, don't forget the risk. You know, on the spot when I stop someone, everything you forget. But don't forget the risk. It's easier than the percentage and the 5%. Would you really, if I tell you a percentage, would you really? What's this? And she's asked, what is the percentage? Doctor, 5% alcohol. You understand? If I give her a percentage now, بتجودي بقى ها؟ It's 5%. No, it should be 3.5. It is the risk.
Okay.
The risk. Do you know the risks of having a medication, such a medication, without prescription? No, it can lead to heart attack. It can lead to, you know, blood clots. It can lead to. You understand? You can use this, but not. Percentage. What's the percentage? Percentage of what? Okay. Yes, there is a very beautiful phrase. Very beautiful. احنا بقى قلنا الدكتوره مها رايقه فعمده بقى. خدي راحتك. There is a beautiful phrase that I think it is the most important phrase in management.
Yeah, you can if it's waiting, the waiting time.
No. Tell her, I highly advise you. This is from the NHS, guys. Everything in NHS, yeah?
Okay.
I highly advise you that you should live in your preferred gender, which we call it social transitioning. From now on, live in your preferred gender. Did you understand the meaning of this phrase?
Yes.
You remember autism? Accept Adam the way he is.
Yes.
This is autism, but different scenario. Accept the way you are.
Accept yourself.
Accept yourself the way you are, and live from now. This is the first step in management. Live
In the gender.
in the gender, in the preferred gender.
Okay.
Live in your preferred gender. I want to be a male. Live your brother, sister. Be. A male wants to be a female. So please advise to live in your preferred gender, which what we call social transitioning. It's very important part in your management. Yeah, it's very important part. So please, you are accepted socially at your work, at your home. Please live in the preferred transition. And it could be like this is the phrase that not many people will say. Boom. Oh my God, live in my yes, your brother, live, live. So very important, way of reassuring. Reassuring. You wanna be? I'm a male, 19 years old. Yeah, I wanna be a female. Be like a female. حد عندك حاجة؟ Be like a female. Start from now. Yes, live in the gender. Live in your preferred gender that you want. Live, and then support and everything else we've said. Okay? Yes, boss.
Can we use the same advice for a younger patient like a 14 years?
No. A younger patient, I when I give the example, I give it in an 18-19. Younger patient still confused, developing. That's why we said the clinic is called gender development. Yeah. Okay. PE transgender.
Doctor, the appointment for the gender dysphoria clinics or gender identity
Took 2
clinics
years.
usually lasts for 2 years.
Yes.
So basically, when we tell them, like, you know, they will ask, like, when will the appointment be? And like sometimes it can take for like 1 or 2
That's why I said to them, live in your preferred gender. Yes.
So they can become frustrated sometimes. So how can we tackle that?
Live in your preferred gender from now. Socially, in your work, at your home. You should live in your preferred gender, and you should accept the way you are. There is nothing wrong with what you are feeling. That's what I said, guys. A big word. Reassure. So please use these phrases. Okay? Live in your preferred gender. There's nothing wrong with
the way you feel.
What is do you have a mock or something?
My son.
Your son? Okay. Do you live in Liverpool? No. Okay, your son, is he coming out of school or something? Or?
Yeah.
That's why. Dr. Ahmed Yusri, we males, we come here. Kids in Maldives or kids in Egypt, they do what they want. They get picked. Seriously, females, seriously, they go through struggle. You know, they're leaving kids behind, they're leaving people behind, they're leaving, you know. But we don't care. Huh?
They will be busy with them.
عشان كده ربنا بيكرمهم فاهم؟ تيجي كده بريجننت وتنجح فاهم ازاي؟ وانت جاي كده مفيش فاهم؟ بجد females high chance of passing in the exam. Females. Anyway, PE transgender and with the Egyptian accent, with our Egyptian accent, BE transgender. Okay, so in Egypt, P and B is just the same. Even for me, after 13 years, P and B. Can you pass me pen and paper? You understand? Okay. You are an FY2 doctor in the A&E. Where?
A&E.
Where do I really care about the transgender? Do I really care in this case of A&E situation about transgender?
No.
Even you are in the A&E. So don't be confused. In these stations, you are not here to counsel me about transgender, but you are here to manage me. Emergency. Please, guys, because the most common 2 cases in Plab 2. 25 years old has taken overdosage of tablets, paracetamol. You are an FY2 in the A&E. Talk to her or him, address their concern. Hi, how can I help you, doctor? I can see you are upset. What did you take? I took tablets, doctor. How many? How did you take it? Okay, before you talk, what happened? Did you write any suicidal notes? Did you, after you talk, what happened? And he's in the A&E. So in these cases, no psychiatric history. Again, if the question said, somebody took overdose of tablets, and you are in the A&E, please don't take 5 questions you ask. What did you take? How many? With what? Did you take anything else apart from this?
When was that?
Did you have any vomiting?
Yeah. When did you take it?
When? And that's it. Then right away do the procedure, which is blood sample
Leveling.
to check the paracetamol level.
Yes.
Yes. Then at the end, he will be given paracetamol level,
Yes.
manage. However, if the station said, you are an FY2 in the psychiatry department,
That's something else.
and the same person who we managed in the A&E, he came to the psychiatry department. Then, before, during, after for 60 minutes, so a low mood, how do you feel, suicidal notes, so no blood sample, and you manage him psychiatry.
Okay.
I've said it unlimited amount of times, and unlimited amount of you take psychiatric history. So please don't. This is the same. You are an A&E. I called it PE transgender, but you're not gonna know unless you talk. You're not gonna, are you the transgender? What PE? Yes. No. How can I help you? Doctor, he's coming with chest pain. But then when you take history, you will know that he's taken or she's taken or whatever, estrogen. So he is taking estrogen and presented with chest pain. So it is not a counseling station, it is an A&E station. You must make him medically stable, not psychiatric. So, please, the patient is coming with chest pain. What to do? Socrates. Sight with one finger, doesn't go anywhere else. Shoulder, hand, jaw to exclude. MI doesn't go to the back of your shoulder. Socrates, back pain, chest pain. After the chest pain, apart from this, any other symptoms like what, doctor? Like what? The structure. Any chest pain, 5 symptoms. Cough, shortness of breath, fever, heart racing, trauma. You ask about the symptoms, medicine station. In this case, because the patient is giving you shortness of breath and some pain, and they are going toward a PE station, be careful. When you ask about, are you, I'm gonna follow the same history, yeah? I'm just now, because we know from day one, P1,
P2.
concerns, P2. So you're gonna ask, any medical conditions? No, doctor. Yes, doctor. Are you on any medications? This is the key. That's how you would know it is that transgender. Am I making any sense?
Yes.
So until you reach on any medication, you don't know. It's an E&E station. Guys, please, I'm gonna keep reminding you. No psychiatric history. No psychiatric history. It's not a case of transgender case and accept the way you are. No, no, no. He is on medication. So when you ask about any medications, the patient will tell you, yes. Yes, I am taking estrogen. Whenever the patient tell you I'm taking something, go to the next question. What for? Doctor, I'm taking it because or for a transgender reason. So then you ask, is it prescribed by a doctor who prescribed it for you? Then he will say to you, I get it online. So he is on tablet, estrogen, and he got it online. So what is the only difference in this station from a PE station? Because guys, you all call it, doctor, how to approach the transgender PE?
The cause.
Nothing, guys, it's just a risk factor.
Just a risk factor.
They give you transgender as a reason. That's it. So it is a chest pain station.
Yep.
But chest pain, one of the causes, they say, yeah, diet, no, bad diet, no exercise, smoking, causes. But this time I gave you the causes. Are you following?
Yes.
So I can change the station. Sorry? No. It's known side effect. So I can give you a station. I make it now, and the GMC will do the same. PE, yeah, and it's a female who is using COCP. What is the component of COCP? Estrogen, for example, station. So it doesn't need to be. I can make it a third station. PE, long of life. PE. So guys, when they brought transgender, you all get confused. It's the transgender. No, it's PE station. But I need a risk factor for you to. So I put that online. Estrogen. So it's normal medicine station, and they put it here for you. Again, 90% of you, they manage me mentally. They forgot it's an NE station. Yeah, you know, you've mentioned to me that that's their management, yeah? Because they call it transgender. So عايزين ناكل عيش بقى transgender. Let's talk about. Then in management, you've mentioned to me that you are using estrogen. Yeah, well, you know, estrogen is one of the medication side effects. You know, I mean, do you have any support around you? How do you find yourself? No, it's not. It's PE. Admit. Senior. Investigations. What are the investigations? Blood. Blood. X-ray. CTP. No. Blood.
Image.
Blood sugar. Clotting profile. D-dimer. Heart attack markers. Perfect. Okay. Then urine. No. Stool. No. Image.
X-ray. ECG.
Chest X-ray. ECG. And then you can talk about CTP. You see later. CTP. Step 4 is symptomatic and step 4 in management. Symptomatic and lifestyle. Guys, if you follow the steps, Dr. Aman, I highly advise you now before the exam. Any management,
Follow the steps.
so you don't forget. Symptomatic. He is in pain. Painkiller. Can you get morphine? Yes. Yes, of course. Okay.
Oxygen.
Now, short of breath. Oxygen. What else? Heparin. Blood clot. Low clot heparin. Yes. Plus lifestyle, which is that
Estrogen that
Cause.
he's taking.
Stop.
Stop. Take
Estrogen. Please, I highly advise you shouldn't take any over the counter, any online medication, and then you can refer him to where? Sorry? 19, 20, 25. Sorry?
Vascular specialist.
Leave the vascular now. I'm talking about the fact. I'm talking about lifestyle now. He's using estrogen. Yes, the identity clinic, where they can give you the proper prescription, because there are other forms of estrogen like what? Patch, which doesn't cause. Guys, when you go, some people, I had this conversation with people about, Dr. Mo, the patches as well causes. No, guys, the patches like gaining like 10,000. So the patches does not cause
Side effects like
the same as tablets. So you can advise him with. But here you're gonna say, we're gonna refer you where they will. But I highly advise you to stop that. It is the cause. And then safety net him. Clear. Is it difficult? So the station, chest pain, Socrates, and whenever you have a chest pain, ask about that. 5 symptoms, medical condition, negative, medications. He give you estrogen. How do you use it? Don't ever assume it's online, yeah? Where from? Doctor, I get it online. Why? Transgender. Now, you will start right away admitting the patient, senior, bloods. We know the blood, the dimer clotting profile, okay? Full blood count, cholesterol level, image, ECG, chest X-ray, CTPA, okay? And if the test to confirm that it's a blood clot, what to do? No, you don't wait for the test. You give right away. But if it's a confirmed to blood clot, long-term warfarin. Long-term warfarin. You forgot, yeah? You remember this patient was on warfarin?
No.
And they said it's rat poison? Now this is the patient who will be admitted and given warfarin to go home. Then he will come to you at a new station. I don't want to take warfarin home, doctor. No, this is flat is 2-bedroom flat. You managed him in yeah? Then the consultant said to you, give him long term. Then he comes as a new station. I don't want to work. I don't want to. He's stable now, going home. Why, yeah, brother, you don't want to? Because it's rat poison, doctor. I don't want to. You know? See? Okay? Then you give it to him. He's accepting it. But learning difficulty. Explain to me, doctor, what's happening, not working. And then, you understand? Okay? So in this case, don't forget to talk about long term. You're not gonna give. But you say to him, if it's a confirmed, I'm afraid we're gonna give you blood thinner that you will use for usually it's 6 months. Yeah? If it's PE.
If it is learning difficulty, he has learned, what's the difference in the way?
What do you think?
It's more clearer only, yes?
That's it. Assess knowledge, check understanding all the time, be slow. Yes. That's it. And then safety net. Is it counseling? Are you gonna go anywhere near transgender? No. Clear, guys. But does he need to stop the medication?
Yes.
Yes, and then you refer him to
The gender.
for
Medication, proper
prescribed medication, yeah? The next station, same principle. Same principle. Headaches and nosebleed in a transgender. Headache and what for? What from? A female is trying to be a male. And do we give her? She's coming with a complaint, but you don't know this. I'm telling you, it is a transgender coming with headache and nosebleed, but you don't know. How can I help you? A female in front of you. No problem. Can you confirm your full name and date of birth? She will. How can I help you? I'm having Dr. Sam or having explore. Headache, explore. Where how, so please guys, give your time in P1, please. Yeah? How do it start? This take regular history. So, same. But this is a female trying to be a male and she's taking testosterone. The other one was a male trying to be a female taking coming with chest pain. I don't care. I'm dealing with
Same approach.
PE. But when I take history, the cause,
We'll turn
I
it
don't
to-
care. I'm gonna advise to stop, advise to stop the online, and I can refer. They can give. This is the same. So, emergency guys, A and E. Okay, so this is the same as the previous station, but it's a female trying to be a male using that increases the blood pressure and causes a headache and epistaxis. Please understand it. Don't memorize it. So, in brackets, the previous two stations, this and the medication side effect. What?
Medication side effect.
You don't need to open the BNF because it's a known side effect. If you want to open it, if you have time, open it. If you don't have time, refer. What do you refer? Say, I will open. No, refer the senior. خلاص ما نازله بقى داون هنفهم بس senior. No, refer to the
Didn't
senior.
see.
Yeah. You will refer that you will open the BNF. So my point is, this case is a medication side. So, how can I help you? Doctor, I have headaches. And I have blurred vision. That's his complaint, yeah? Explore. When did the headache start? Blurred vision and epistaxis. But please, I'm not gonna go into headache 2 minutes, epistaxis 2 minutes, then 2 minutes. No. Headache. How did it happen? Doctor, it's chronic for about now 1 month, doctor. It's increasing. It's just all around my head. What about the bleeding from your nose? Yes, doctor, it was a week ago, 10 days ago. I mean, do you feel dizzy? Why do you feel dizzy? Too much bleeding. So it can, Yes, doctor, and I'm having blurred vision. Apart from these symptoms, anything else? No, doctor. Anything else like what?
Blood disorder.
Could you relate it to something?
No. I'm talking about, guys, P1 is finished, yeah? What's after P1? DDs? Guys, you must ask about high blood pressure, chest pain, shortness of breath. Have you had any heart attacks or strokes? Yes or no? A patient is coming with headache, blurred vision, epistaxis. What is the first thing you'll think of? High. So always ask about chest pain, shortness of breath, heart attacks, stroke and mini stroke. DD's finished, like that. That kind of history, sorry? Well, mostly it's kidney. But this is what I'm saying, this is the relevant. Boom. Because high blood pressure can cause chest pain, shortness of breath can cause strokes, many strokes can cause kidney problem, and that's it. Relevant. Then, apart from this, do you have any medical conditions? He will say,
No.
she will say no, sorry, she will say no.
On any medication.
Are there any medications by any chance? What medications are you using? Testosterone. May I ask why? Well, doctor, I'm trying to. Oh, really? Don't show any. It should come. Even your facial expression shouldn't.
Any medication.
Like any medication. Since when have you been using it? Prescribed by a doctor or not? Following the prescription or not? The same as the estrogen one?
Yes.
Is it counseling station? Am I here in the clinic for the patient to talk about counseling? No. Then carry on the history. Then management. What is your management here? Guys, management nothing but
Stop the medication.
the medication should be stopped that they are using. Okay?
Investigate.
But the medication is important for them. First of all, let's start from the 6 steps so we don't get lost.
Okay.
You are in the GB clinic. It's a GB clinic case. No. Senior? Yes. Investigation. What are the investigation that you will do here?
Clotting.
Bismillah ar-Rahman ar-Rahim. Cholesterol, blood sugar,
Clotting.
Clotting.
factors,
Clear.
CBC, yeah.
Because it's a headache. And any urine? No.
No.
Stool? No.
No.
Image?
Could do
ECG.
ECG.
Because you think of high blood pressure, heart, I mean, he's coming with headache, blurred vision, hypertension.
Yeah.
So ECG. Okay?
Just X-ray.
And now You can do chest X-ray, yes. And now come to step 4. Step 4, symptomatic and lifestyle. Lifestyle here is what he's taken. Is what?
He's taking testosterone.
He's taken testosterone. Advice, again, if he's taking it online, same approach. If he's taking it online, not with doctor advice, same. Okay? And you need to refer. And I can even be smart. Can he be following up with the clinic? Yes, maybe it's prescribed, maybe it's not online. Then I can refer him to the same
Clinic.
Yes, so I refer to your doctor. When is your next follow-up? It could be tomorrow. So I don't refer. When you go, so when is, that's if he is with a clinic. Guys, are you clear with me?
Yes.
So guys, doctora, small changes I can put on the station. You know the station with the PE transgender? I could change, doctor, one word.
Prescribed.
That the estrogen is prescribed.
In
And
your
then
next
you can
appointment,
say,
tell them.
okay, are you using it as prescribed? Yeah, I am. Yes, doctor. Because you're gonna stop it, yeah? When is your next appointment? Doctor is in 3 days. All right. When you go to your doctor, I will give you a referral letter, and when you go, explain what happened,
so they can change
so
it.
they can review the medication. كده simple كده natural. Okay? Don't say no, you have to stop it because it's online. No, doctor, I'm doctor. Wallahi from my doctor. I'm not online, and I'm, you know. And then I will refer you. No, doctor, don't refer me. I'm already following up with the doctor. You understand? One word difference, but it makes the examiner like, oh, what's up? Refer you understand? She is following up with the doctor. So, doctor, I'm following up. When is your next appointment? Tomorrow. You don't need to say I will write for you. No, she's going anyway. She's got an appointment. So, small words.
And
Big change.
It is okay if I stop it suddenly. So in testosterone and
No, I
estrogen.
don't think so.
So it's okay if I stop it suddenly. There is no.
If she is following with the doctor,
Prescription, no.
if she's following with the doctor,
Do not.
okay, but prescription, no. I said to you, prescription,
Yeah, prescription.
go for follow up with the doctor. But if she's using a medication outside, I will refer her anyway.
Yeah, but
Yes.
it's okay if I stop it suddenly. without
Now,
gradual
guys, you know what to
progress.
think of referral to this or that? They get seen within. So if I'm in a hospital and I say to you, in the I will refer you to psychiatrist. By the way, you're not gonna take your clothes بقى وكده no. Bleep, like my bleep. I look, the bleep, okay, I ring. I'm Danny, doctor, I've got a patient here who's with me downstairs. I managed him, but come and have a look at كده, you know, that's the referral.
In the hospital.
In the hospital, the referrals is all there.
As long as the
Okay.
medication.
So psychiatrist can go to see the patient who's in the ward. So, always advise about that. Oh, we've mentioned the management. In management, you've noticed that I have done blood to exclude other causes of
The bleeding.
blood pressure and bleeding.
Yeah.
Anybody is lost. Have you noticed in management when I said I will do cholesterol, blood sugar, clotting profile? Why do I do so? Because I'm excluding other causes. Because it could be not the testosterone. Huh? Could be something else. What is the presenting complaint?
Headache.
Headache, blurred division, epistaxis, which equal one word, it's a high blood pressure. So in investigation, in history, I have focused on the complication of blood pressure, which is
Chest pain.
strokes, mini strokes, heart attack. Guys, I always want you to understand the station, not to memorize it. That's why I'm trying to make things, you know. So because the presentation is something to do with blood pressure, the questions in history is something to do with complication, which is heart attack, strokes. And in management, I am looking for other causes that can cause high blood pressure, cholesterol, clotting profile, blood sugar, full blood count, kidney function, because the blood pressure can affect the kidney, and then ECG, complication of high blood. So write down in this, it's a high blood pressure station. Write down, it's hypertension station. That's it. And in management, I'm managing about the cause, which is the medication. Yeah? Sorry?
She's complaining of headache,
Yes.
so we will provide painkillers.
Yes.
Symptomatic bleeding.
Yes, symptomatic, perfect.
And is it, we can refer him if the blood pressure is very high, for example, give me a reading. Maybe we will manage visiting, for example, for following up or something?
Wallahi, I was just gonna mention now two things. She mentioned one of them. She ruined it. I was gonna mention that because we are seeing the station is what?
High blood pressure.
Would you like to see I will measure it? الراجل قاعد دماغه مصدع و bleeding. وانا just in the clinic or not?
Yeah.
What? So make sure you verbalize that you will measure blood pressure. Clear.
Heart rate.
You will verbalize. I will measure it. And in history, what did we miss in history?
If you
Data. Is this important here?
Yes.
High blood pressure. So always here, smoking,
Diet stove.
alcohol, diet. I said at first, this is not important. But now he's coming, yes, the cause is testosterone. But I know the testosterone now from, it's transgender, But when you're taking history, is it only testosterone or could be due to lifestyle?
Yes.
So, if you understand the station, it's high blood pressure. Causes of,
High blood pressure.
complication of,
High blood pressure.
management is, examination, measurement high blood pressure. Clear?
And treat, in this case, maybe I will ask my senior to give you some medication for...
Yeah, we can give medication for blood pressure, yes. To decrease the blood pressure if the blood pressure is high. If I get given 190 over 100, yeah, you can give him, I'll give you medication for that, for your blood pressure. And safety netting, toss. What is safety netting? Blood pressure. If you stroke, weakness, slurred speech, chest pain, same. Okay. Last station, but I'm not gonna talk much about it because you should know it, because it's not. It's lesbian depression. This is the title, yeah. Lesbian depression. Depression. So this station is totally psychiatric. Psychiatric. She's a lesbian who's coming because she has low mood. Because she has okay. Please, in this case, it is pure psychiatry. Pure. We cannot bring, we can't. Counseling and psychiatry. So she's lesbian, she's not happy with something, but at the same time she's depressed. Cannot happen. Either she's getting bullied, not happy, she's depressed, she wants to change her gender, she's thinking they cannot. So this case is proper psychiatry. Low mood, always ask about suicide, psychiatry. Always, whenever a patient is having low mood, always ask about how bad is the low mood affecting their life. Appetite? Yes, I remember still from an hour, 2 hours ago. Appetite, daily activity, because if the low mood is bad enough to affect your daily activity, and if the low mood is bad enough to affect your sleeping, if the low mood is bad enough to affect your eating, if it's you cannot do your daily activity, you cannot do your work, you cannot do your job, you cannot look after your kids, it's considered as not mild, moderate or severe. So in this case, you will start with antidepressant. Okay. Management of a case, a patient who is depressed, mood, suicide, drugs, alcohol, social. So management. Make sure in history. What is the first bullet point we've said in the lecture? In history, support. People around you, relative, friends, and my support. Don't forget, we are here to support you. You understand my support how?
Reassurance.
WhatsApp number, take the WhatsApp number. And, before you go to bed, text me and I will tell you, a good night, you are not by yourself. No, support. Support system, when you start by yourself, by reassuring her. Okay? You are not by yourself. We are all here next to you. We'll make sure that everything is fine. So, start. Have you spoken to anybody? Why don't you speak to your family member? Why don't you understand? So the support system is here, family, relative, me, and groups. support groups. Now, in this case, make sure you exclude bullying. Yes, it could be the reason why she's having depression, bullying. Yeah, whenever you have a case of depression, what is your management steps? I will start with this, then this, then this, then this. Stepwise. First, support. Perfect. Support. If support is not enough, support, when I say support, is everyone. Yeah? If support is not enough, step 2, talking. Professional talking therapy. No, not enough. Medication. Antidepressant. No, not enough.
Admission somewhere.
خلاص بقى ما فيش حاجة. So please, do not ever start medication from the start. Always support, talking, medication. But when do we give medication from the start?
The level of depression.
In severe depression. So if I, doctor, if I come to you, low mood, not affecting my daily activity, not affecting my job, not affecting my appetite, do you want to give me medication?
No.
CBT, support. No, if I'm coming to you, but always cover your back. And if that doesn't work, we're going to start you on medication. But if I'm coming to you, low daily activity, bad appetite, not eating well, not sleeping well, then you can give me medication along with the support and the CBT. Is it clear? If it's bad enough to affect your daily activity. Okay? And always end your station by safety letting off at any time you feel low. At any time you feel that you having any bad feelings of hurting yourself. There is numbers we will give you and 24 hours and you have all the support. Always close your station by safety netting.
Should I exclude psychosis?
Sorry?
Should I exclude psychosis? Yes.
You know, hallucination is in any case. I mean, if you ask it, if you have time for it, ask it.
Is it
yes. Hallucination, guys. Hallucination is one of the MEC famish.
Yeah.
But always prioritize. You have the time? Oh, can I ask about alcohol? Yeah, why? If a patient is stressed, we drink alcohol. What about drugs? Yes, but in the exam, can we bring in a depressed patient, low mood, suicidal, with alcohol and addict? No. It is an alcohol station. Cage TWD. It's something else. It's the same structure because alcohol will ask about mood, ask about suicide, but it's something else. I'll ask about only alcohol. Okay? You are tired. You seem all of you like, tired and yeah. So guys, I would like